Okay, I think we can get started while a few people are still filtering in. So good afternoon or good morning or good evening, wherever you're joining us from. For those of you who don't know me, my name is Amy Savage and I'm a technical officer at the Climate Change and Health Unit at WHO. And I'm really pleased to welcome you to our second webinar in our Climate Change and Health technical webinar series. So today we're discussing a very important topic related to accessing climate finance for climate change and health, and specifically the Adaptation Fund, with WHO as an accredited implementing entity of the Adaptation Fund. Before we start, just a little bit of housekeeping. So we do have 2 sessions for each of our technical webinars, one in the morning and one in the afternoon, to cover several time zones. We are covering the same content in each of those sessions, so no need to attend both of them. You can see here the schedule for our upcoming webinars. We've just added a new one, which will be happening on the 15th of May on the operational framework for building climate resilient and low carbon health systems. So you can head to the website and sign up for that one if you're interested. And then you'll see we do have a range of other webinars coming up. If there's anything in this schedule that you're really interested in us covering and you don't see it here, please do let us know, send us an email. So in this session, we do have simultaneous interpretation in both French and Spanish. In the morning sessions, we have French and Arabic. So if you do need to use the interpretation, see the instructions on the screen now and just set that up. We have set this event up as a meeting rather than a webinar in Zoom so that we can engage, and particularly in the discussion session, there'll be time for Q&A. But there are a lot of people joining us today in the meeting, so please do remember to stay muted when you're not speaking. Also feel free to use the chat, the Q&A, and we'll endeavour to respond to you during the session or follow up as needed. Please also note we are recording this webinar so that we can put it on the website for those who couldn't make it. And now we'll quickly go through the agenda for the session. So in a moment, we'll hear from Elena Villalobos-Prats, who's the lead for country support and capacity building in the Climate Change and Health Unit. Then my colleague Antonis Kolomenakis will present on WHO as an accredited implementing entity for the Adaptation Fund. And then we'll hear from the Adaptation Fund about the funding opportunities and the process for developing proposals. Following those presentations, we will have a good amount of time for some discussion, for some Q&A, so we can answer some of your questions. So I'm pleased now to hand over to Elena.
Thank you, Amy. Good afternoon, everybody. I'm Elena Villalobos-Prats. I lead the country support and capacity building work on climate change and health in WHO. And basically, through the years I've been working in this team, 15 now, we had the opportunity to really work closely to countries to understand their needs, and we recognize that accessing to funding and finance for climate change and health at country level is one of the key priorities countries find to advance action at country level. There are different initiatives and programs that WHO has been implementing over time to try and support countries to address this need for funding. And I'm pleased to basically recognize the work and the support that Adaptation Fund has done over some years now. Basically, they were the ones coming to WHO and inviting us to become accredited. They recognize health as a priority for the work they promote on adaptation because they see that countries are prioritizing health among one of the sectors most impacted by climate change. And basically, they were great, supported us to get accredited throughout all of the process. We think that this is a very important opportunity for countries because the process is potentially simple, and WHO is already working, for example, in a proposal in African region, and we understand that the Adaptation Fund is open and inviting other proposals to be submitted. So I think this is an important topic. I'm really grateful for the support that the Adaptation Fund is providing, both in terms of availability today to be part of this important webinar, but overall for their leadership supporting health And I also would like to thank my colleagues Antonis and Amy for putting together this webinar and the overall series. So with this, I think I can hand over to my colleague Antonis for his presentation. Thanks, everybody.
Thank you so much, Elena. And so in this first set of presentation, we will have the opportunity to hear a bit more about WHO's for supporting as an accredited implementing entity for supporting access to the Adaptation Fund different schemes. And I would like to start by this important infographic, which shows the key intervention areas through WHO's mandate for supporting climate change and health, which is, of course, based on different country needs and different challenges posed at different regions and different contexts within the globe. So as we can see, there are three focus areas. The first one is on addressing the wide range of health impacts of climate change. And these, of course, are related to some of the more highly evidenced health impacts, disease impacts, like in the case of malaria, of cholera, and diarrheal disease outbreaks, different types of diseases related to heat stresses and extreme weather events, and of course, a wide range of other health impacts related to mental health, related to forced displacement of population, and other important outcomes, as well as, of course, the direct impact of health in healthcare facilities and the health system overall. So in this respect, it is really important to strengthen the health systems in terms of their resilience and environmental sustainability, and make sure they are ready to respond to those different challenges. In addition, it is really important to recognize those co-benefits that can arise both through the mitigation and the adaptation actions, and also the different cross-sectoral benefits that can come from addressing health in a comprehensive manner. As Elena already mentioned, there is a high level of engagement in supporting countries through WHO for different types of projects. So stats indicate that at least 150 million USD have been mobilized and implemented through different projects in different countries. And this, of course, relates specifically to countries that are more vulnerable to the impacts of climate change and health, but also creating important dynamics through the contribution of other countries. However, we would like to emphasize that there is still a huge need, a huge financing gap, specifically when it comes to the access of the health sector on climate financing, on climate funding. And in this respect, the accreditation of WHO to the Adaptation Fund is a milestone, is a very important benchmark that indicates a very positive sign on the importance of health in the global agenda. In addition, and more specifically, we would like to present those more specific actions and key areas of intervention when it comes to support different countries. So those 5 important areas are related to assessing what are the different health risks as well as the co-benefits, making sure that there is an adequate climate change and health planning at different countries level, of course supported through the regional and global expertise, ensuring that the adequate finance arrives at the health systems level, and making sure that the operations can be sustainable. Of course, implementing different types of intervention, such as the vulnerability and adaptation assessment, health national adaptation plans, different activities, making sure that that health is a key part of the national adaptation plans. And for this, there are separate tools and guidances and approaches developed and supported by WHO. And lastly, it is really important to monitor that there is a progress on the one hand, but also there is an update on what are the different challenges, because as we all understand, climate change is an evolving phenomenon that might create new challenges in different areas, even in areas that that had not experienced in the past the impacts of climate change on human health. In all these efforts, it is really important to recognize the WHO's operational framework on building climate resilient and low carbon health systems with the specific building blocks for health system, which are related to leadership, to enhancing the health workforce, making sure that the adequate health information is available at the health systems level, ensuring that the essential technologies and products are availed, making sure that there is the service delivery for addressing the impacts of climate change and health, and of course, ensuring the adequate financing, the adequate resource mobilization to support these endeavors. And it is in this respect that, again, we highlight the importance of WHO being an accredited entity and being in a position to support specifically the resilience of the health sector to the effects on climate change, along with other efforts and some other streams that are supported through other grants, such as the Green Climate Fund Readiness Mechanism, and in collaboration with other entities, the overall Green Climate Fund financing portfolio. In addition, I would like to highlight the importance of a global initiative, which is called the ATACH. This is an initiative that has been built out of the momentum coming from specifically the COP26, which was the time at which countries under the leadership of the UK's presidency, as well as WHO support at different country levels. So countries submitted their high-level engagement signed by the ministries of health at its country level. We have more than 80 countries that have submitted those letters of engagement on building climate resilient and sustainable low-carbon health systems. And in this respect, this mechanism, which is called the ATACH, is operating in order to monitor and support the implementation of these submitted commitments. The structure of the mechanism is very inclusive. WHO operates as the overall secretariat, and the chair alliance, the chairs of the alliance are actually the COP presidents, UK, Egypt, and UAE. And of course, there is a multi-participatory and inclusive approach when it comes to participants, such as different countries, development agencies, different experts, development banks, multilateral development banks, NGOs, civil society, and a wide range of partners and stakeholders that contribute. In addition, there are specific subgroups for monitoring and supporting the work. So, for example, there is a work on climate resilience, on decarbonization, on financing the commitments, as well as monitoring what the impacts of climate change is on health and nutrition. Some more specific activities that come out of this important initiative and are also driven through WHO's technical expertise and support on country support are related, as I already mentioned, to the conduct of a vulnerability and adaptation assessment, which is a key prerequisite for having a comprehensive mapping of what is the key diseases that impact certain population in certain geographic areas at the country's level. Of course, establishing, and also this supports on establishing the Health National Adaptation Plan, which should be based on an overall national adaptation policy and the overall national adaptation plan of a country. And of course, there are other related activities to the low carbon and sustainable component, which in certain cases can also have tandem effects to adaptation and resilience. In terms of WHO's accreditation, as already mentioned, since the end of 2023, WHO has been approved as an accredited implementing entity. This was announced at the time when we had the first ever Health Day at the COP. So it is also another building block of momentum and advocacy. So in this respect, WHO supports countries. As Elena mentioned, we have already started supporting certain proposals, but under this role of implementing entity is ready to support countries on more specific proposal development for adaptation planning, for developing strategic frameworks, and making sure that the country's health systems are more resilient to the impacts of climate change. We will have the opportunity through the presentation of the upcoming presentation by Adaptation Fund colleagues to hear more on the different processes and different modalities and prerequisites for implementing and for developing and designing a project proposal. As we said, we have already developed successfully a first pre-concept note, which has been approved through the board meeting of the Adaptation Fund. And now it's in the next process of the concept note and full proposal development. There are certain other regional proposals in pipeline. There is a high level of interest, and that is why we're very happy to be holding this webinar in order to also gain more information and gain more expertise on this important process of WHO's accreditation and support on building proposals through the Adaptation Fund. And lastly, I would like to mention that we are also in the process of developing a frequently asked question manual on the Adaptation Fund processes under WHO as the implementing entity, which we will be happy to share with you in the next upcoming period. And with this, I would like to hand over now to our colleagues at the Adaptation Fund. We will also share with you those slides, and we will be happy to receive your questions while in this webinar, but also after this. So kindly over to my colleague, Ms. Saleha Dubarsis, who is leading the innovation and programming at the Adaptation Fund.
Thank you, Antonis. Hello, everyone. It's a pleasure for me to be here, and I'm very grateful for this opportunity organized by WHO to share with you some information about the Adaptation Fund. And thanks for support in moving the presentation forward. May I have the next slide, please? What I'm going to talk about today is how essentially the Adaptation Fund makes financing available to countries, developing countries that are vulnerable to climate change. Specifically, I will spend a little time, a little extra time maybe, discussing the different funding opportunities, so the different windows that we currently offer. And we will be also maybe discussing some oncoming opportunities as well. And then I would like to walk you, and I'll try to be brief and expedite the process, but just to walk you through the different components of a proposal, as well as our submission and review process. So this will just give you a taste of how the Adaptation Fund works, and then I'll be happy to engage in discussion with you, hopefully. Now, the Adaptation Fund has the mandate to finance concrete adaptation projects and programs that are country-driven and based on the needs, views, and priorities of developing country parties that are particularly vulnerable to the adverse effects of climate change in meeting the cost of adaptation. This mandate was given to us by the UNFCCC process. The fund was established under the Kyoto Protocol, and this mandate has been interpreted to mean visible, tangible efforts on the ground in communities, the most vulnerable communities, communities that are most vulnerable to climate change, let's put it that way. And the Adaptation Fund serves the Paris Agreement now by accelerating effective adaptation action and efficient access to finance, including through direct access to respond to the urgent needs and priorities of developing countries. And we do so by supporting country-driven adaptation projects and programs, including in innovation and learning and sharing with concrete results at the local level that can be scaled up. So often our projects are first of its kind, of their kind in the context where they're implemented. Our work is structured around 3 core pillars. And those are called action, innovation, learning, and sharing. This is from our current strategy, which covers the period of 2023 to 2027. I will talk a little bit about what these mean, but suffice it to say for now that in addition to supporting adaptation projects that many of you may be already familiar with, we also pay a lot of attention to innovation, finding that edge when it comes to adaptation, and supporting the development of innovative solutions for adapting to climate change. And we also recognize that all these investments generate huge amounts of data and information, and we would like to parlay that into knowledge and share it, make it available to as broad a range of stakeholders as possible. We also have a bunch of cross-cutting beams, and I will read them out very quickly. Those are to promote locally based or locally led adaptation, to enhance access to climate finance and long-term institutional capacity, to empower and benefit the most vulnerable people and communities as agents of change, to advance gender equality, to enable the scaling and replication of results, and to strengthen complementarity, coherence, and synergies with other adaptation funders and actors. So this, in a nutshell, is our strategy currently guiding our work. Next slide, please. In terms of our portfolio, you see the snapshot here. Again, just to say that we have been established in 2001, operationalized in 2007. Our first project was, I believe, funded in 2011. And since then, our portfolio has grown to over 1.1 billion US dollars that have been allocated to 160 projects under implementation or already completed worldwide. All developing countries that are parties to the Kyoto Protocol or Paris Agreement are eligible to access funding. The proposals have to be country-driven, and we believe our access is quite streamlined. What this has resulted in is a portfolio of diverse projects in a variety of sectors, and you can see in the pie chart on the bottom left a bunch of different sectors. Just to say, water management comprises 11%, agriculture 13% of the portfolio. We don't really have a little slice that says health yet, but that is only because not because we haven't encouraged or wanted or been able to support health. We have, but those projects have not yet been really put forth by the countries. And like I said, the programming is country driven. We are sector agnostic as an institution, as the fund is, does not prioritize or earmark funding for any particular sector. So we're hoping this will change. Many of our projects, in fact, do have health related activities or components, but we really hope that this will strengthen and change soon in the future. And as you can see from on the right side of the slide, the biggest chunk of our portfolio is in Africa, followed by Asia, about 30% there, and 25% in Latin America and the Caribbean, and a small portfolio in Eastern Europe. Next slide, please. So as I already mentioned, the adaptation projects that we support are intended towards concrete adaptation activities in the most vulnerable communities. This needs to translate into visible and tangible impacts at the local level that can be scaled up. As I also mentioned, there are no prescribed sectors or approaches. Proposals need to be country driven. and developed through a country-driven process that accommodates countries' priorities and adaptation reasoning, and need to be in line with countries' strategies and plans and NAPs, NDCs, and such. We finance the full cost of adaptation. So unlike some other funds, there's no co-financing requirement. And also we provide grants exclusively. Please note that 50% of all funding is reserved for national implementing entities and or direct access. And so the total allocation for projects and programs submitted by multilateral implementing entities such as WHO cannot exceed 50% of resources. So sometimes we do hit up against that cap, but that doesn't happen very often. And when it does, it doesn't, the projects sit in a wait list for a few weeks, not very long, as has been our experience in the past when that did happen. So the amount of funding that is available to each country for single country programming is $20 million. However, there are other pots of funding or other funding windows that fall outside of this cap that are also available to countries, either for regional or other types of special types of single country projects. So I will talk about those shortly. Next slide, please. All right, so I think we can go to the next slide. I believe that is the slide on the different funding options. Yes, so here are the available funding windows under the Adaptation Fund. Here on the slide, they're organized according to the 3 pillars, which I mentioned earlier: action, innovation, learning, and sharing. Now, if you look under the action column, this is actually where most of our portfolio lives, if you will. It comprises of single country projects that are funded from under the 20 million per country cap. Those projects can be up to 10 million each. And this funding is available to all types of implementing entity, be they national, regional, or multilateral. Then we also have regional projects. This is outside of the country cap. These projects can be up to $14 million. This funding is available to regional and multilateral implementing entities. Each year, the board decides on an annual funding provision for regional projects. I think at the moment, a couple of weeks ago at our board meeting, the board decided to allocate $60 million for regional projects for the upcoming fiscal year, which starts in July. And these projects consist of 2 or more countries within a region, mostly. Now, we also have locally led adaptation. This is a growing theme of interest for us. We have had a funding window, a related funding window that was called Enhanced Direct Access, that was available to national implementing entities only. We have now revamped that window and brought the criteria more closely in line with the locally led adaptation principles. And these funds are now available not just to national implementing entities, but regional and multilateral implementing entities. Again, this falls outside of the $20 million country cap. And it's available $5 million, not per country, but per project. Sorry about that. And there will be other locally led adaptation related windows that have not yet been set up, but I will mention them in a later slide. Then under innovation, we have small grants of up to $250,000 that are available to national implementing entities only. But we also have small grants that are available to entities or organizations, community groups, small businesses, so on. So basically stakeholders on the ground at the local level who are not necessarily accredited with the Adaptation Fund, and they can access these small grants through the so-called Adaptation Fund Climate Innovation Accelerator, or AFCIA. We have several multilateral implementing entities that are currently administering AFCIA programs. They include UNDP, UNEP, CTCN, UNIDO, and WFP, and actually the last several programs that were approved for this are $10 million each. So yeah, those are global programs, and there will be a couple more coming on, and there will be an opportunity to join the AFCIA partnership perhaps as soon as next year. There will be a call for expressions of interest to the multilateral and regional implementing entities to see whether there is interest in administering such a program in a particular, could be in a particular theme or topic or even region. Then we have large grants of up to $5 million that are targeting, again, innovation. They can be single country or regional. They're available to all implementing entities, and they too fall outside of the country cap. There is a learning grant of opportunity for national implementing entities only. So I think I don't need to dwell on that, but we can move on to the next slide instead. There has also been a change regarding project preparation funding. So we do offer project preparation funding, and this is big news. Again, at the last board meeting that occurred recently, the board has decided to expand the provision of this support beyond national implementing entities. So now multilateral and regional implementing entities can access project preparation funding, or PFG, project formulation grants. And the sizes of the grants that are accessible has also increased. So there's some detail there that we don't have time to get into now, but I'll be happy to share separately. Next slide, please. So I've already foreshadowed some of this, but we are going to be posting very soon the instructions on and the application materials for single country LLA projects, because that has just been approved by the board. We will be issuing a call for requests of expressions. We'll be issuing a call for expressions of interest for to multilateral implementing entities and regional implementing entities to serve as aggregator for small grants under the locally led adaptation. I was mentioning AFCIA, which is a different mechanism, but this is a new mechanism that is actually modeled after AFCIA, the innovation one. And this would be for locally led adaptation. So there will be information circulated to all MIEs and RIEs soon with instructions on how to express interest. And that will be coming out in a few weeks. And then we're working towards developing a regional locally led adaptation project and program funding provision. That is something that we will be proposing to the board in October. They've already given us a green light to develop this proposal. And I've already mentioned the further expansion of AFCIA. So like I said, requests for expressions of interest to join that partnership can be expected sometime next year, probably early in the year. Next slide, please. So now I will try to breeze through the main components of a proposal. And this is in a way quite general. So we have different funding options, obviously, and they have slightly different requirements and criteria, but I will focus on those that are common among them all. And yeah, in the interest of time, we'll try to keep it brief. Next slide, please. So what I want to say here is that all the application materials are available on our website. I've provided the link there where you can find a bunch of materials for different funding windows. They look something like this when you open the file, and so there are different sections, and I will walk you through the key sections or key elements that we would expect to see in such a proposal. Next slide, please. And each of these submissions or templates or application forms come with instructions and guidelines. So and they basically look like this. So for example, for each section, there is an explanation what it is that how we would like you to fill that out. Next slide, please. Something that is very important, and this is also found on the list of the documents, is our environmental and social policy. And so all the projects need to be in compliance with our ESP and need to show in some detail how this is achieved. So this is an important policy, and we have online trainings also that you can take at your own pace regarding this policy and other policies. The policies, this particular policy comes with a guidance on self-screening and self-assessment, description of and guidance of each environmental and social policy principle, and guidance on how to present relevant environmental and social risks information in the concept or fully developed proposal document. Next slide, please. Yeah, so I will list a little bit the review criteria or key elements of the proposal. In terms of country eligibility, as I've mentioned, any party to the Kyoto Protocol Paris Agreement is eligible and has to be a developing country. Basically, non-Annex 1 countries, according to UNFCCC, would qualify. Next slide, please. All submissions have to be accompanied by an endorsement letter signed by the designated authority that we have on file. And I really like to emphasize that very often, well, too often, I should say, maybe not very often, but still too often, proposals face a delay in processing because for one reason or another, the letter of endorsement is not valid. The letter of endorsement can be valid when it's not signed by the correct person, or it could be signed by the designated authority, but the Adaptation Fund has never received the nomination. You know, if there's been a change in the designated authority, we've never received that communication. So you need to make sure, and you can do so by checking on our website. We have a list of designated authorities. Make sure that you have all that squared away before we can even start to process your proposal. Next slide, please. Proposals need to show that they support concrete adaptation actions to assist the country in addressing the adverse effects of climate change and building climate change resilience. There needs to be a description of activities, how the activities help with the adaptation and resilience, Are they concrete? In other words, they produce visible and tangible results? Is there a solid project design? Is the intervention linked to the climate threat? Are the non-climatic barriers or risks taken into account? And the full proposal needs to be quite elaborated with details and specifications, and very closer linkages to climate change scenarios, and so on and so forth. Next slide, please. And for regional projects, we also need to include both regional and country value added. So why does this need to be a regional project as opposed to, let's say, 2 or 3 standalone single country projects? That needs to be articulated. The project needs to provide environmental, social, and economic benefits, particularly referring to vulnerable communities, including gender considerations. We can move on to the next slide. Then for cost effectiveness, I think there needs to be a logical explanation why the proposed scope and approach were selected for the particular adaptation challenge, given all the variables and available financing. The sustainability dimension is important. In the full proposal, there needs to be a clear description of alternative options to the proposed measures. Their quantification in monetary terms is not required, but is very useful when possible and available. Next slide, please. Yeah, we were skipping over the regional because of the time, but it's okay. I mean, for regional project, we just explained how regional approach would support cost effectiveness. So there's that little extra dimension with regional projects that need to justify why the funding that's outside of the country cap is being accessed. So now the proposal needs to be consistent with national strategies and plans. It should be consistent with other strategies such as poverty reduction strategies and national communications or national adaptation programs of action or and other relevant instruments, NAPs and DCs. And concept stage, and in case of innovation projects, TNAs, technology needs assessment. And TAPs, those, I forgot what they stand for, but this is all in our documents. So at concept stage, there should be an identification of key strategies and plans, and at the fully developed proposal stage, there should be a detailed explanation of compliance with these relevant plans and strategies. Next slide, please. Also, the proposal should meet relevant national technical standards. The Adaptation Fund does not apply any particular set of standards, but abides by the national technical standards or expects the proposals to abide by national technical standards. And this can include environmental impact assessments, building codes, water quality related regulations, land use and sector specific regulations. And for full proposals, regulatory clearance has to be received and technical feasibility ensured for core parts of the project design. Next slide, please. The proposal should also discuss any duplication or overlap with other funding sources. Of course, the project should not duplicate with activities funded through other sources, and any overlap, actually, I should say, needs to be synergistic and complementary. There needs to be identification of all potentially overlapping activities. At fully developed proposal stage, there should be a clear outline of linkages and synergies with each relevant project. Yeah, I think we can move on to the next slide. Okay, so this is an important element. Each project needs to have a knowledge management component to capture and lessons and share them. So again, as I mentioned, learning and sharing is a core pillar of our strategy, and we consider this an important investment towards addressing climate change and adaptation to climate change more globally. Next slide, please. All proposals need to show that they have been developed using a highly consultative process. The consultative process should involve all relevant stakeholders, including vulnerable communities and women, and whoever is relevant. It's very context specific. There should be an initial consultation before concept submission. For national implementing entities, okay, this is no longer relevant, sorry about that. For full proposals, there should be a description of a comprehensive consultation process involving all direct and indirect stakeholder groups, including vulnerable groups. There should be inclusion of stakeholder views reflected in the project design. There should be a list of stakeholders, ways of consultation, the key findings of consultations. And under extraordinary circumstances, consultations can be deferred to a later stage. However, this has to be justified. Next slide, please. So projects need to provide justification for the funding requested on the basis of the full cost of adaptation. Since we do not require co-financing, we need to understand if the funding requested is going to be adequate for the activities that are being proposed. If there is co-financing, which is fine, we need the assurance that should that co-financing for some reason not materialize, that it would not jeopardize the project, and that its goals would be or objectives would be achieved even if the co-financing failed to materialize. Next slide, please. There has to be a discussion on the sustainability of outcomes. Project and program outcomes should be sustainable beyond the end of life of the project or program. It should also enable replication and scaling up with other funds. There should be arrangements in place for ensuring sustainability, and this can include maintenance, continuation of processes, and so on. And when we talk about sustainability, we mean all key areas: economic, social, environmental, institutional, and financial. Next slide, please. We also like to see the project, or need to see that the project or program management arrangements are adequate. So there should be a description of roles and responsibilities of the implementing entity, as well as any executing entity or organizations or stakeholders that are involved in the project. And for regional projects, we expect description of arrangements for management at the regional as well as national level, including coordination arrangements within countries and among the countries, and how the potential to partner with national institutions has been considered and included in the management arrangements. We can go on to the next slide. There needs to be an identification of all major risks, considering their significance and including a plan of monitoring and mitigating them. That usually looks like a table such as this one. And I think we can go to the next slide. There should be a results framework. This is an example of such a results framework for one of our projects. This can be done at whatever format the institution prefers. However, if we move to the next slide, it should be aligned with the Adaptation Fund's result framework. So we do have a result framework. By the way, we are revamping it, so there could be a different one starting next October. But essentially, we have 8 objectives. We expect at least one of them, or one objective and one indicator. Well, we expect the project to be aligned and to adopt and use a report on at least one fund outcome indicator. So yeah, and in certain cases, for example, the innovation projects, there's also an innovation specific indicator that also needs to be reported on. Next slide, please. The proposal obviously would need to include a budget. It should be detailed enough with budget notes, with explanation on the implementing entities management fee use, and an explanation, a breakdown of the execution costs. And for regional projects, the budget should be broken down by country as possible and applicable. Next slide, please. And finally, the disbursement schedule. It looks something like this. Each year, the implementing entity is supposed to send a report to submit a report to the Secretariat on its activities. That report is reviewed, and then based on its clearance, a tranche for that year can be released. And so this basically shows a disbursement schedule for each year. Next slide, please. Yeah, I don't think we have time to get into this, but I'm happy to share this information. This is on the rules regarding the new rules, I should say, regarding the project formulation grants. So, you know, for single country projects before 2 million, it's a certain amount, so it's up to 50,000, and then this can go up to 150,000 for bigger projects, and for regional projects especially, up to a maximum of 250,000. Next slide, please. Now, how are proposals submitted to the Adaptation Fund? Well, that can be done at any time. We accept submissions on a rolling basis. Once a proposal is sent to the Adaptation Fund, assuming that it's accompanied by a valid letter of endorsement, we undertake a technical review within 3 weeks. So that is our business standard. So within 3 weeks, the implementing entity receives a technical review. We encourage the implementing entity to revise the proposal within 3 weeks as well, send it back to us. This allows us to have a few back and forths and hopefully get the proposal to a technically cleared stage, at which point it would be forwarded towards the next next closest board meeting. We're also available for the Secretariat technical team is available for discussions on the proposal, for example, after a technical review has been completed, to provide further clarifications verbally, for instance. So I think that's it. On the next slide, I think what we have is contact details. My email is there, as is of the members of my team for different windows, funding windows. Please feel free to reach out, and happy to take any questions you may have in the time remaining. Thank you.
Thank you so much, Saliha, for this great presentation and for this extensive information that you have shared with all of us. And we are now, we would now like to open the floor to the participants of this webinar for certain questions. And we would also like to acknowledge that we have received questions on the Q&A that we will also endeavor to reply in the second round. So in this first round, we would really welcome and encourage you to please use the hand raising function and pose your question live. I cannot. Okay. Heba, please. Heba, I can see that you've unmuted yourself, but we cannot hear you. So maybe, Heba, if you would like to check your microphone, and in the meantime, let me go to
Can you hear
the.
me, Anton?
Yes, now we can. So please go ahead with your question.
Okay, great. Many thanks. Just I dropped my question in chat actually. Firstly, many thanks for the presentation so far. Quite interesting, quite comprehensive. My question regarding our the regional projects. Sometimes the list of NDAs, the current NDAs, is not for some countries. It's not up to date. For instance, for Iraq, the nominated NDA was the Ministry of Health and Environment. At that time, the both ministries were one ministry. And now the government of Iraq, they separated the two ministries. So in such case, what we should do? In other countries, the nominated person is retired or replaced. So in such case, the endorsement letter should be signed by who, or what we should do in such cases. That was a question. Thank you, Antonis. Thanks, dear Saliha.
Thank you, Heba. Just to clarify, we are talking about designated authorities versus national designated authorities, which is the terminology used for the Green Climate Fund. There is a list of designated authorities, so I guess that you have checked this list on the Adaptation Fund website for cross-checking the information you just shared. But I would, what I would maybe suggest is that you could reach out to us, and in turn we could write to the Adaptation Fund colleagues for ensuring that we have the updated information for all the interested countries for which we want to support the development of a proposal. But I don't know if this answers your question, or you want to further expand, Eva?
Can I also jump in?
Please.
Just to quickly clarify the process. And by the way, you may have seen that I have dropped in the chat the webpage that contains the list of designated authorities that we have on file. Now, sometimes, like Heba said, the person who's a designated authority for the Adaptation Fund may have changed, may have retired, but the fund has not been informed. And so we need to receive a letter of nomination of designated authority. This letter can be signed by a minister, ambassador, or cabinet member. That's what our rule is. But we need to receive it in order to change the name of the designated authority and to be able to accept a letter from that person, signed by that person for any particular project as a letter of endorsement.
Okay, great, thank you.
Thank you so much to both Heba and Saliha. Can I now hand over to Nani Santana?
Hi, thank you for the explanation. I have a question about the cost effectiveness section of the proposal. It mentions that we should also mention the alternative options to the proposed actions, like that should also be included in the proposal. And I want to understand what that means exactly, like what would that consist of?
Thank you so much, Nani. Can I hand over to Saliha for this question?
It can mean a lot of things because, of course, we accept proposals in so many different sectors and different contexts. But essentially, the idea is very simple. If you're choosing a particular set of actions, we need to see why that particular set of actions has been chosen. Have you considered alternatives? What alternatives have you considered? Were they not more cost effective? So why have you chosen them? And it's not necessarily that the most cost effective alternative, or no, I should say the cheapest alternative is always the best. So it's a little different, but we do want to see that you have considered different options, and for compelling reasons, you have settled on the option that you are proposing, and we need to see that kind of reasoning. I'm not sure if that answers your question. It's a big topic.
Overall, yeah, I know. It's just like a little follow-up. So usually how extensive would that be for us who are planning on writing a proposal, just so that we can have an idea?
How expensive is the
Extensive, how extensive the
how
argumentation
extensive.
should be on the alternative course of actions, you know?
Okay, well, it also depends. It's a very difficult question to answer, how extensive it should be. But what I can suggest is all the proposals that have been approved are available online, and you could take a look at some of the proposals and see what they have proposed and how they have handled it. So that will give you an idea, probably. And I'm also happy to dig deeper into this, but we would need more time. So if this is an issue you would like to discuss, please feel free to reach out to me.
Thank you.
Thank you so much. Can I kindly invite Adugna, please?
Thank you very much. I'm very much delighted that there is hope for health in funding, because the health sector is one of the sectors that relies on adaptation. Although we have a certain portion of mitigation, I think adaptation is one of the important things. One thing I'm afraid is that the capacity in the health sector, you know, the capacity in the health sector is a sort of disintegrated. That means public health institute, academia, implementing like Ministry of Health. They are working a bit of in a, you know, it is not only adaptation. The research has to feed the adaptation system. So how things are harmonized and how the instructions and the guideline is pushing them to work together. That is one of the areas I would like to hear, because I'm from research. I know which adaptation options are available, best experiences in different geographical areas, whether they are in the same sub-region or in different parts of the continent. So I think people in the ministry, they are more off on the implementation. And the academia is also having people who are well aware of the science and innovations. So how this adaptation fund is trying to pull the country level caliber into this adaptation proposal. So the health sector has the capacity which is placed in different institutions. This is one of the things I would like to raise. And another issue is that whenever there is a regional application, it is natural that countries who are well performing and having well-developed institutions, they come together. It is less likely to pick a country which is lagging behind. So how are countries in the same sub-region we have in IPCC report, we have 5 sub-regions. We have all the main South, North, West, East, and Central Africa. And you know how these countries are likely coming together. So how the guideline is guiding us to bring countries in the same sub-region could apply together and they can see impact together. Thank you very much.
Thank you. Both very good questions. On the science and practice part, I mean, this is complex, but proposals are country driven. However, we do, I think through our requirements and criteria, I think we do encourage and sort of catalyze this necessary collaboration between science and practice. For example, the proposal, the activities, they need to be linked to the best available science and evidence there. There is, and there is a section on essentially the adaptation reasoning. So basically linkage to the impacts and how they would be, and the actions flow from that analysis. There is also this aspect of consultations, a consultative process in designing the proposal that should ideally include the scientific and research community, essentially, because they're the ones who are able to advise on what the issues are and what they're going to, how they're going to evolve. We do have that mandatory element in each proposal for knowledge management, a knowledge management component. So we do obviously see a strong potential role of research and academia there. So these are some of the entry points of ensuring that science and practice come together, and hopefully it translates into that. Now, in terms of how to include countries that are sort of left behind, this is an important issue for us. We do see that, for example, fragile or conflict-afflicted countries, which are, I mean, really vulnerable, some of the most vulnerable, don't have the systems and processes in place to successfully access funding. So that is a major problem. On the other hand, for implementing entities that are able to work in such contexts, it is in a way an opportunity, because what that means is these countries are less likely to have exhausted the funding under the country cap. So the $20 million is, for example, you know, not going to be exhausted in countries, some of the countries that are conflict afflicted and fragile. I don't want to name any names necessarily. Whereas the countries that with high capacity are reaching the limit, and so, you know, you wouldn't be able to, they wouldn't need necessarily additional support in projects and implementing them.
Thank you, Saliha. Can I hand over to Anwar in this?
Hello, thank you so much. No, really appreciate, hello colleagues, Antonios and Saliha, really appreciate the very informative webinar. I have just 2 concrete questions. The first, I think you may have answered in your previous statement, but it's regarding the 20 million country caps for the action window. So the question is, do these caps refresh, or is it kind of once they're exhausted, it won't be refreshed?
Okay, so right now, so for a long time, the country cap was $10 million, and then the board I would say about a year and a half, maybe 2 years ago, I don't know, time flies, decided to raise it to 20 million because the countries, many countries had already reached the $10 million cap. So they raised it to 20 million so that the countries that had reached 10 million could access another 10 million. Now the countries that hadn't accessed anything are still able to access 20 million. At some point in the future, we hope not too long from now, the board may decide to raise the cap again. So this is essentially how funding gets added to the cap. But when we say, 10 or 20 or 30 million, that's cumulative. So, and some countries have come close to exhausting the total amount.
Okay, thanks so much. That's really helpful. And then the next question was about the project formulation grants. So just to make sure I'm clear on it. So first, is there a time limit for using these within the cycle of the proposal process? And two, in terms of using the PFGs, is it valid to use these for like conducting a baseline study or assessment? And could we also use these on like the consultations to develop the project?
Yes to all of that. There is a list of all the activities that are eligible under PFGs, and I have some slides on that, but there was just the presentation was already heavy as it is. Yes, and for the time limitation, I believe that the PFGs need to be PFGs are approved if the proposal requested one at the time when a concept or pre-concept is endorsed. So PFG is used normally to develop a fully developed proposal, and in some cases to develop a concept from a pre-concept, a smaller amount. And it is used mostly for consultations, for assessments, baseline studies, for elaborating environmental and social management plan and assessing risks and doing a gender assessment or a gender action plan. And it can be used for travel, for putting together consultation events, for those kinds of things. It cannot be used for purchasing vehicles, for example. So there's a list of what it can be used for and what it can't. But I think it sounds like you have the right idea generally. Now, between the approval of let's say endorsement of a concept note or approval of a PFG grant, which happens at the same time, and the time when we expect to see a proposal, a fully developed proposal, should be 12 months. If an extension is needed, that's fine. So that applies also for project formulation grants, but that is the time frame, essentially. Yeah.
Thank you.
Can I please invite Veronica Brown?
Thank you. Thank you so much for this comprehensive presentation. My name is Veronica Brown. I'm from Women Deliver. I think Saliha and Anwar's question addressed some of what I wanted to ask here, but just to kind of bring it back to, I know that the PFGs, for example, give the opportunities for organizations to consult on the project and kind of gather the consultations needed, but they're only by national implementing entities, right, that can apply for the PFGs. And just wondering if their support, some of the things that we hear from civil society and activists is that they have a hard time completing these complex processes and accessing whether it's the government, the official kind of government entities that can support this plan or becoming a national implementing entity. So wondering if there's support from the WHO side to support these more grassroots organization accessing and applying to these to the grants provided by this fund.
That's a question for WHO. but I could also talk about the options at the Adaptation Fund. I mean, we're quite aware of that, and we started actually through innovation, because that was that's where there was fertile ground for taking on a new approach, and using actually multilateral implementing entities like well, we haven't done it with WHO yet, but multilateral implementing entities with presence on the ground that were then able to provide grants to grassroots organizations that therefore did not need to be accredited with the Adaptation Fund. And so we will be doing that with this that I mentioned, locally led adaptation global aggregator as well, in addition to expanding the AFSIA partnership, which again is targeting focus on innovation. So those are some of the ways in which the local and grassroots organizations can be supported. Of course, the locally led adaptation options, be it single country projects or this regional vehicle that we will be designing soon, are basically projects that receive funding from the Adaptation Fund and then devolve this funding into grants toward the most appropriate local level. That is essentially the principal design of locally led adaptation projects. So these are some of the ways in which we hope to support the grassroots levels and locally active organizations and entities.
Just to add from my side that when developing proposals that are led through WHO, we make sure also with the contribution of the regional colleagues, the country colleagues, WHO level that are involved to ensure inclusive approaches, and also includes the activities that could engage with the civil society and with wider stakeholders, ensuring that health is well articulated, and also that different groups of interest are involved and benefit through the proposals that we will be designing and we are currently designing. So just to highlight that the inclusivity is indeed important and well recognized. It was also an issue that we took note during the morning session. So I think we will make sure to further include the local voices and the local communities. In any case, just to also highlight that these local perspectives are highly encouraged through certain activities such as the vulnerability and adaptation assessment, and even within the HNAP and NAP processes. Just to give an example, the inclusion of indigenous knowledge is very highly recognized and highly encouraged. So it all indicates that it is also very apparent and very important for us to include these the local community and those civil society-led approaches. I do not see further hands raised, so I think we could go to the Q&A. So I will be reading the questions that we have received. So the first question is, how are country-level efforts in various departments, public health institutes, research, MOH, and academia are harmonized, coordinated for a better, impactful adaptation scheme? I can take this question. So one of the key instruments to which we highly encourage to be formulated at the country level, and it is indeed highly linked to building a strong, resilient health system. It's, for example, the creation of a technical working group on climate change and health. Ideally, this should be led by the Ministry of Health and incorporate and include stakeholders coming from other departments of the Ministry of Health, such as the National Institute for Public Health, departments related to overall surveillance. In addition, it is highly encouraged that different sectors such as the environment or the education or the agriculture, infrastructure, transportation sectors, that all can have a positive effect and create important health co-benefits through different actions are invited, along, of course, with organizations of civil society, along with academia and research, ensuring that we have the latest available evidence on the impact of certain diseases on human health. So if I'm not mistaken, in this proposal that we have already submitted through our African regional office, there is we already foreseen the enhancement of relevant mechanisms. So this is something that we take very high into consideration, and it is a mechanism to ensure that health is elevated wide across the overall national policies. And indeed, the Adaptation Fund gives us the opportunity to further enhance this type of activities through the design of certain proposals. The second question is related, what actually reads, what mean innovation in this context? I think it's related to the innovation component. I don't know, Saliha, if... So the question as articulated is, what mean innovation in this context? I think this might relate to one of the slides.
Yeah, no, I think so innovation, as mentioned, is one of the three pillars that guide strategically the Adaptation Fund's work. What it means in this context, and that is an excellent question, by the way, because adaptation in of itself is quite innovative. But what it means specifically in the Adaptation Fund context is that the board has given us permission to each year set aside some funds for innovation programming, whereby the metrics at the portfolio level are such that risk is there's a higher tolerance of risk, which means that with these projects, you are really encouraged to reach for ambitious, innovative approaches that actually may not be successful. But we're hoping that they would be very successful and that they would lead to, I don't want to use the word paradigm shift because in the GCF that means something specific, but it really leads to, next level action. Finding innovation basically is a way to find out something that works radically better than what we have so far. And in the context of our countries, it can mean a lot of different things. Innovation in one context could be something that's been used for a long time in some other place. So it's quite context specific, but often it entails a very sort of, well, we're aiming for something that's quite transformative for that context. So when it comes to innovation projects, unlike our typical adaptation projects where you basically do the climate assessment, the vulnerability assessment, I mean, and you look at the climate risk and you determine, okay, this is what the risk is. And so this is the kind of infrastructure we're going to put in place. For example, sea level rise of X number of centimeters. We need a wall that's a seawall that is X number of centimeters to protect us from that. Innovation projects are not like that. They're more, they should be more process oriented. So you need to have a problem for which you don't know what the solution is necessarily. And I mean, you may have some ideas that you wish to test, but you have a problem, and then you need to come up with a process. There's a whole science of innovation, how you do that, the iterative learning and adjustments, and there are also practical ways in which you bring in innovation through competitions, challenges, accompanied with specific kinds of supports. For example, young entrepreneurs may have lots of creative ideas, but they need support and on the financial end and so on and so forth. So these are the kinds of things that this type of project aims to support, to help build the innovation ecosystem in a particular sector, so that we can achieve solutions that are far more effective in the effort to adapt to climate change. It's a big topic. This is something we've been working on a lot. But yeah, in a nutshell, that's the idea behind innovation programming.
Thank you, Saliha. The next question on the Q&A is, I'm curious that health adaptation is the bottom line for the sector. I'm surprised why Adaptation Fund is not targeting health, but I think actually the aim of this webinar is to highlight that health is now one of the important sectors within the Adaptation Fund. And yeah.
If I may add,
Please.
I mean, the Adaptation Fund Secretariat, we have talented technical staff who certainly understand climate change and its effect on various sectors, and health being a key critical sector, essentially, for the well-being of all of humanity, obviously. But to connect the dots, to have actually countries and specifically ministries in the countries that participate at UNFCCC and negotiate and have the access to the information and the ability, especially in very challenged environments, to share that information, to make it accessible, to engage the health ministries, for the health ministries also to develop their own capacities. It has been a process from what I can see, but we have always been open to funding health, and WHO becoming accredited was a big milestone for us, because we do see that as being a part of the puzzle that will hopefully help coalesce into this action that I think we all recognize is really necessary and important.
Thank you, Saliha. Jumping to the next question, not responded orally, which is, are there mechanisms in place to ensure that funding is properly appropriated so that it moves from national allocation to regional and local projects?
So so for regional and local projects, when you say regional, I assume you mean subnational regional projects and local projects. So the funding under the country cap, the $20 million, the countries are free to use that however they want, and they can use it for projects that devolve funding to subnational actors. Some funding, there's, and I wrote this in the chat actually, we have examples of projects that target, for example, a city, a particular subnational unit. But we also have examples of projects where there is, for example, a fund facility set up whose role is to provide smaller grants to subnational or local actors or in grassroots organizations. And again, locally led adaptation funding opportunities will aim to build on that and encourage that further and support that with additional funding. So those are some of the ways in which, I mean, all of our funding can be used in that way, but now we have specific provisions that are targeting especially local and subnational support.
Please be very quick. We've already exhausted the time.
Okay, I appreciate you. The question was more from a point of fiscal responsibility for those like conflicted, afflicted, and fragile nations. And a great example, just for sake of time, I had a country that I was working with where they received $5 million, and what trickled down to where it actually needed to be was the equivalent of $26,000, which wasn't enough for them to do anything with. So I was just wondering if there were mechanisms in place to ensure that where the funding is intended to go, it actually has the ability to have impact and effect.
Yeah, I mean, this is it's a challenging issue, of course. I mean, we look at the complete proposal. If there is a proposal that proposes something that we know, given the circumstances on the ground, and it's actually really the implementing entities who often know better, then we have some mechanisms in place that give actually the implementing entities the possibility, for example, for direct project services, so to implement directly, to execute. So implementing entities can also execute projects. Now they have to have the capacity to do so. They have to have the presence on the ground and all the processes involved with that. But that is certainly an option that has been used, particularly in the kinds of contexts that you mentioned. So yes, we do have that flexibility to ensure exactly what I think you're trying to ensure.
Thank you so much. Just considering that unfortunately we've come to the end of the allocated time. Just to highlight that we will make sure to respond to those questions offline that had not been answered during the course of this webinar. And whether important, we will ensure to incorporate them in the frequently asked question manual to be shared in the next few days or in due time. So let me kindly ask my colleague Elena to give us a closing remark, and please, Saliha, you are also welcome.
Thank you very much, Antonis, and thanks so much, Saliha, for the excellent presentation. I see that there were a lot of participants connected throughout the session, and this shows how important this topic is for the countries we are aiming to support. So I think the content was very clear, and we will share the recording with all the participants, and then we will be happy to synthesize if there are any additional questions that need answers to be addressed also, thanks to the Adaptation Fund. I think that's everything from my side. Probably just to finish, thanking all the participants for their interest in climate change and health overall, and of course for increased action on climate change and health. So thanks so much, Saliha, Antonis, and everybody for your time.
Thank you so much. It was a pleasure to be part of this.
Thank you so much, colleagues.
Thank you. You guys have a wonderful afternoon. I appreciate this immensely. Thank you.
Thank you so much.